Huge thank you to CIBC for making We Get It possible. Good evening, everyone. My name is Karine. I'm the program director with Young Adult Cancer Canada, and welcome to a new episode of We Get It. We Get It comes on live Facebook, 7 p.m. Eastern every Monday, and all of our episodes live on our YouTube channel. So you can catch everything on there with closed captioning, actually, if you go on YouTube. So that could be useful for you. I hope you're well. I'm good today. I actually am wearing my hair down. I have dark hair and they're down because I cleaned them. I showered, washed all of them. I'm French. I usually speak of my hair in plural, and I'm wearing a black shirt. It is a sunny day actually in St. John's today. At the time we're recording this, so my room is bright, which always makes my heart bright. So this is me today, and I am in wonderful company. A long time friend and YACCer, a health professional. So we're going to have conversations on many levels today. Christine Skakum, welcome.
Hello.
Thank you.
Hi.
Hello,
You're
my
welcome.
friend.
Thank you. Oh, it's so lovely to just have this hour. I feel like I'm stealing something precious.
No, I feel the one that is lucky. Thank you for being with us today.
Yeah, no, my pleasure. So I am also sitting here in a very brightly lit room. It's super sunny here. It's going to be plus 10 today, which is wicked for
Yeah.
Winnipeg. Well, I'm outside of Winnipeg, but anyway. So nice and bright. I am wearing a light sweater with a burgundy tank top and long dark hair and very, very little eyebrows. So I put on a little lipstick for you.
Thank you. Yeah. I
Yeah,
I look at that. I check that all the time.
the eyebrows.
The lipstick. I look at nothing. I was
Yeah.
saying over time, we get over this Zoom camera meeting. Thank you, my friend, for being here. Like I said, we've known Christine for a long time. But today we're inviting her. We'll hear a little bit about her story because I know it relates to so many of you within our YACC community. But Christine is also a healthcare provider, and we're going to talk a little bit today about. We've all known this last year has been quite demanding on everybody, but most definitely on our healthcare professionals. And I would say and argue that really the system, our healthcare system, can be quite taxing and demanding on the healthcare professionals on best of days. So the last year has been hard. So we're going to talk a little bit about that together and maybe explore together ways that we could maybe help ourselves as healthcare providers, help the healthcare professionals and providers that we see as patients, as maybe part of the system. So that's kind of what we're going to talk about. But let's start first, Christine, by getting a context of how we've met. So your connection to cancer and your connection to YACC.
Okay, well, my connection to cancer, man, that goes back to childhood, really. There's so much cancer in my family. It's a little bit strange. Um, and I feel like well, I'll get into it a little bit later. But anyway, so I think it was 2009 was the first time I ever heard about YACC. My cousin had cancer and he was going to a YACC retreat. My brother-in-law had time to go, was able to get some time off work. So he went with him and they had a fabulous time. So that was the first time that I think my cousin Earl had ever felt, really understood and super supportive. And even my brother-in-law had said, how incredible it was. And lots of times for people going to something like that the first time, it's like pretty intimidating and I'll go because he wants me to go, but I don't know if I'm going to get anything out of it. And I think he really did get quite a bit out of it.
Yeah.
And then the following year, my sister was diagnosed with a recurrence of her cancer after 10 years of being clear. So she wanted to go to a YACC retreat. She had been diagnosed with metastatic melanoma and it appeared as a brain tumor. Uh, so she had had a craniotomy in December, and then we went to retreat. I think it was May
Mm-hmm.
at Edenvale. Lovely, very beautiful, beautiful, special, special place.
Yeah.
And it was incredible. That retreat was really incredible. And you know what? I think a little bit about all the little things that went wrong in other people's lives to make it happen for me. Like it was so strange.
I
So
know.
Natalie first had applied for retreat, and then she was on a wait list because she kind of heard about it last minute. And then somebody canceled, so then just she could go, and then someone else canceled last minute. I think it might have been only a day or two between me buying my plane ticket and me getting on the plane. My older sister was actually supposed to go to the retreat with her because she really needed some time to take a time out and process what was happening. And
Yeah.
I'm a nurse, so I always kind of know what's happening 10 steps before it happens. So I was doing better.
You knew what was going to happen in 6 months. Like, yeah, we're fine.
Yeah, we're fine. Not until you actually realize that it's happening to you, right? Your loved ones. And then it's different. But anyway, yeah, so Laura wasn't able to go. So then I ended up going, and it was really, really special. We joked a little bit because the time that we spent there, we almost felt like everything else was left behind. Like I didn't forget that I had kids, but I kind of felt like it every once in a while. You know, you're in the pool or you're in the sauna or you're in group, and everything else just kind of melts away, and you're just there with the people who really understand what you're going through. And when I was at the retreat, though, it was a little maybe because I didn't expect to be going, maybe because like I did definitely hit it off with some of the supporters, but I almost felt like I was connecting more with the facilitators, with the people that were there. So I spent a lot of time with some of the facilitators and the nurse that was there, and kind of was talking about, you know, her role and what she, you know, benefited from it and that kind of stuff. So
Yeah.
that was cool. And then what? So then I went home, and I got a call or an email not too long later saying somebody is sick, the nurse is sick, and we need a nurse for conference. Would you like to come? So, and then the rest is history
The
after
rest
all those
is
conferences and retreats. Yeah,
yes. And
many
the
years.
story, like love story continues to this day. Like my very last retreat before pandemic started a year ago was with Christine. So we were in Ontario the week really that this whole that like the world flipped. We were already there. The retreaters were there. So we kind of went with the retreat and everything kind of changed. By the time we were going back home on the Monday, the world was quite different. But to your point, though, I think for the 4 days we were at that venue, we lived in that bubble, which I'm still to this day so very grateful for the time we spent together before so many things got put on hold for so many people. I know many of the young adults who came said, I'm so glad that we got a few hugs, in before we couldn't hug our close ones and our friends and our family members. But this was the last time we saw each other in person, and I'm so
Yeah,
glad.
that was a really, really special retreat. Like looking back on it,
Mm.
um, not any more special than all the other ones, but then once we left, it definitely became a lot more special.
Yeah,
Yeah.
it did.
I look back at my pictures on my camera roll, and I was swimming in a swimming pool at a hotel in Toronto, like
Yeah,
4 days before the whole world stopped.
I know. Some behaviors that were so normal. So, for those of you watching who don't really know what the retreat is and what we're talking about, obviously, right now, because of the pandemic, we are not yet in a place where we can hold face-to-face events. But when we are back to some sense of normalcy in that way, we will definitely start putting information about those retreats and our face-to-face get together because they're quite powerful. It's really just opportunities for young adults to get together with their peers and have health professionals like Christine and others come and then support them as they process a little bit of what comes with cancer. So they're not happening right now, if you're wondering. We have some stuff online happening, which we'll let you know. But this is what we're referring to, the both of us. So it's a nice memory, but then I guess we all went back home, and so like you mentioned, you're a nurse, like that's your work, um, and I know, I guess at the beginning of the pandemic, we talked a little bit more about, yay, health professional, thank you, and now it's been a year, and I'm not saying people are stopping to be grateful. I know that the all of this had many impacts on our community members, some people for treatments, for surgery. Like there's about 100 layers of challenges. But today we'll focus a bit more maybe on some of what our healthcare providers were facing. What do you have any? How has it been, I guess, and what have you observed?
Yeah, like even when you're just talking about when you're saying the long list of things that people have to go and do by themselves now, like I think the biggest thing is that we're all just broken hearted.
Hmm.
You know, the support that normally, like in the YACC community, I'm reading all these things. People are going for brain surgery and they can't even have their mother there, or, you know, like it's just awful. I'm in palliative care. So, palliative care tends to have a little bit of a case by case basis as far as visitor restrictions and stuff like that go, but still it's the whole grieving process
Mhm.
too that we can't do the way that we used to do. I actually was just I'm doing a course with Andrea Warnick
Yeah.
on children's grief and bereavement, and so we were talking a little bit about disenfranchised grief
Mhm.
and just the abnormal grieving processes that we're going to have. And I feel like people are just taking it up on themselves to do things differently. Like, so she was saying in Toronto, it's kind of a big thing now where people are even doing their own funerals at home,
Mm.
and cutting out the funeral home and trying to make it, you know, more special. But I think that's a big part of it is just
Mm.
the disconnection. We're social beings and
Mm.
people are feeling very disconnected. And so it's ways that you can connect. And not everybody is like really super great with social media or like comfortable with Zoom chats, but you know, just trying to stay connected. So I feel the health professionals, part of it is all the extra layers of PPE, having to question people constantly, and the looks that you get sometimes when you are asking the questions, because everybody's like, I don't have COVID. Like, stop asking me that. Because everywhere you go, people are reminding you what the symptoms are, right? And they're like, yeah, I get it. I don't have it.
I know.
And just like we're in a relational profession, so I feel like for me one of the hardest things is communicating with people with all the personal protection on. So like when I go to do a home visit, I for sure will always be wearing a mask and goggles. So I have my ID that says this is me, look, this is my face, right? But if they're hard of hearing, or if, you know, some of my patients have dementia, like sometimes they want to read your lips because that gives them more cues. The body language is all off. Sometimes the PPE can even be scary if we're dealing with younger people.
Mhm.
So that one's tough, but you know, we get creative with some of that.
Yeah.
Yeah.
And
Um,
some of the people I've been talking to, so I know a bunch of people work in all different cancer centers across the country, and I guess in some ways what I felt was hard for patients, so for the young adults we work with, but also for those providing care was, well, of course we didn't know what we were getting ourselves into. So there was this at the beginning anyways, this kind of, we're just going to give a big push and then it's going to end, but then it never really has
and
yet. So I feel like the demand on healthcare providers to constantly, so it's almost like, well, It was not just 2 weeks, and it was not just a month, and it was not just 3 months. And then, there's been these moments where you keep hoping for it to end, where now it's like really stretching long, and it makes it really hard to maintain maintain well, to do the things you need to do to maintain mental health, your body, all of it, because the stress we feel, like sometimes I feel everything right now in the world, like the energy of the world. And so people in the healthcare system, it has to be intense at times to be with
Well,
them.
and how to, yeah, like how to deal with it, right? Like I know when it first started, I just feel like the foundation of all the stuff that's happened to me since COVID started, the foundation is always worry, right? Like when it first started, and we didn't really understand, I was reading, like about everything and trying to figure it out. So that when people would ask me questions, I'd kind of have a little bit of information to give them so they could decide for themselves or a place for them to look. But things that I was really worried about was like we didn't know if it really transferred very well through services.
Mhm.
So I couldn't imagine being someone who felt like they had to, when they finish at the grocery store, which is very anxiety producing, then wiping down every single item from the grocery store before they came in the house. Like that was just the beginning of it. And then you worry about all the Lysol and all the, bleach and all the hand sanitizer that our bodies are absorbing. Like there's all those things that, people were worried about. Um, just how I always say, you do the best you can with what you have,
Mhm.
because that is more important. Like your sanity is really important. You can't burn yourself out just with a grocery shop, right?
No.
Um, and then we kind of got like, okay, so then it was like, okay, PPE, are we going to be short? Can we, trust the system to provide safety for us and all that kind of stuff? I have I have friends that work in ICU. I have friends that are paramedics, firefighters, police. And a lot of our concerns, of course, is about like PPE, how much to wear, is it safe even to do your job? Like, I think some of the police officers weren't really wearing the goggles or whatever right away because it wasn't really safe for them. So that kind of stuff. But then also worrying about, okay, I'm the one that's out and about. So if someone in my house gets sick, it's my fault. And oh, like I have a son with asthma. It's like, am
Are
I
you
gonna bring that? Am I gonna bring that home to him? Um, but and then you see, definitely in some of the bigger centers where people were so scared of, yeah, they would actually live in another part of the house or they would move out. People were living in garages, they were living in tents, and I don't know, there was one company that was letting people um, have like a travel trailer to stay in for a while, like
Yeah.
totally free, because they were so worried about all that stuff. Like we're scared of everybody getting sick. We're scared of like the healthcare system being overwhelmed. And then what if I get sick? Right? Like
Mhm.
what if we all get sick? So it's all, yeah, it was a lot of worry. But then I think we kind of trended into like the new normal where we just kind of had our procedures. We felt fairly confident with how it was easily transmitted and how it was not so easily transmitted. And so then you kind of just get back to work and you do your thing. And now to me, like you said, I think it's absorbing all of that energy from the world and we're all doing it. And I've heard people actually say that it's almost like we have this societal mild post-traumatic stress disorder even,
Mhm.
right? We just are all have big feelings right now and we have to be aware of that, not just for ourselves, which is super important, but for everyone else that we're in contact with, for sure.
Absolutely. It's the unpredictability. And I think, like, you touched on so many things that ultimately I thought of when I was talking with either members of my family who are in the healthcare system or my friends like you and others, where there's this double, you don't want to get something at home if you have kids, for example, and then bring it to your place of work if you're working with sick and vulnerable people,
Mhm.
and you don't want to get something from the hospital or the your workplace and bring it home. And this kind of constant, so for everybody, we could argue everybody who was working outside could have that concern. But I know that for our healthcare workers who were working with either people with COVID or vulnerable population, we saw what that did. And that level of responsibility that you kind of own, like I know my cousin that I love and adore, but she is so careful, and I get it, and a part of me loves her for it because she knows how how much in contact she is with so many possibilities, and but that kind of mindset is it's like high vigilance all the time. I'm looking
You
for,
can't carry that on.
it's constant stress in some levels. And to your point, I do hear you, and I believe that for a lot of the healthcare providers, once the protocols were installed, once I'm sure that it's like, okay, we know what to do. This is what we do. This is our job. But the rest of the population, as we know, the mental health, the stress. And we were saying for people with cancer, it's not like because the pandemic started that cancer took a pause. It didn't. So then
Mhm.
people come to, institution healthcare providers with this load of stress sometimes, and frustration, and having waited longer than they thought they were going to be, and fear. And then the person on the other end has to also figure out how to cope with this, which can be easy.
Well, and that's huge too, right? Like I think about all of the time that I spent in waiting rooms and being supportive. And one of the things that we did with my sister was whenever she had a scan or an appointment, we'd always go, and then like all the girls, so me and my other sister and my mom, and then we would do something really fun after if she felt up to it. So it was kind of like, balancing it all out. And or even just going to chemo and playing crib and eating pea creams, like I got a 28 hand when I was sitting in the chemo room, and everybody was so excited. Like I didn't have 29, but 28 was the best in my life. Anyway, when I think of all of those things that we did and all the people that we even connected with, gosh, like we would talk to other people, like when we were in Gamma Knife, or other families that you talk to when you're in the waiting room. Like there are informal ways that supporters were getting support just by going to appointments and stuff.
Mhm.
And now that was all done. That was just taken away. So, yeah, sometimes the family there is what makes them feel safe enough or brave enough, or just like will tolerate going for some of these treatments.
Mhm.
I can't imagine her going for brain surgery and just being all by herself. But I know people are doing it. People are doing it now. And it's just sad. And
It
we
is.
understand for the big picture. Like lots of times I'll say to people who are ill or have had a big accident that's going to take a long time to recover, I say, you know what? This is a year, like, or 2 years or whatever. Like, this is this window of time. And then you're going to get your life back. We're going to help you eventually, right?
Mhm.
But we don't know how long this is going to be for. So I can't say that. It's like we
No.
do the best we can with what we know every day. And yeah, just like you were saying earlier, just wake up and try and have a good day and have some fun and plan for that, right?
Yes, because ultimately, like what one thing you said, which is so true, is because of the changes that so many people had to do and go through. So for treatment, for surgery, for all kinds of things within our community. To your point, we know a bunch of people who were dropped at the hospital. Someone waited outside, but they had to go at it alone. Again, it kind of puts back a not a burden necessarily, but definitely a different dynamic for the healthcare providers, the person plugging the chemo into someone else, or because it's like, well, you're going to be the person who's going to be by me because my husband, my friend, my sister, they're not in there with me. And I know for having talked to some colleagues, that has been hard to see the distress in the patients, to see that they felt very scared and alone, and not necessarily to be, you can't replace what your sister or mother or whoever would do for you,
Yeah.
if you're, the nurse or the doctor, or so that's hard as well.
Yeah. Well, we talk a lot about that, like in palliative care in particular, but in a lot of areas, the family is the intervention. We
Mm.
might not have a medicine that's going to make it better, but time with the family is love and security and a distraction, and that can make a world of difference. And now we're really, trying to limit that. And so I think that's the biggest thing, honestly, that I see that people are distressed about is the visitor restrictions for sure. And just to know that everybody's really doing the best they can. The system is trying to protect everyone.
Mm.
Um, and just to be like gracious with it, I guess.
Mm.
But I worry too because our system is not always 100%, and there are cracks to fall through. And so it's intimidating going into a system where your advocate is not there with you. What if you are so, like, you can be so sick or so vulnerable when you're not yourself? You're not thinking clearly because you're ill,
Mm.
and now you have no advocate, and so things can go terribly wrong. Hopefully the healthcare providers are a lot more in tune with this, but I certainly am, and are watching for those kinds of things and asking those important questions to make sure that everybody is getting what they need, right?
Yes,
And
I get questions like, to your point, like some we'll touch now on a little bit of the ways we can help ourselves and help others, but I think you put the finger on something important, which is some of the questions need to be different now. So if you are a healthcare provider seeing a patient, or and someone who is alone, like, I'm sure that the screening of certain things are the same, but other things are okay. The context is different now, so I need to approach it differently. But on the flip side, like, because sometimes I feel, which is okay, but we often, when we talk of care, definitely focus on the patient. We want the patient to be at the center of everything. But for this to be maintained, I think sometimes we definitely need to turn the lens to those providing care, because if nobody pays attention to how they're doing, them doing a good job with the patients is going to get more difficult, and especially when we live in a long time of crisis and long period of crisis, and everything you've mentioned has been witnessed by someone. And as we know from day to day, sometimes we feel like, wicked awesome when we wake up, and other days we don't. And so then when you go, you're affected very differently by people's suffering or fears or anger, and then you have to find ways to take care of yourself. What are some of the ways for you that you've taken care of yourself so you could keep taking care
yeah,
of others?
you certainly brought up a good point because there's definitely some days where you know that your day is going to be full of distress, like other people's distress, and you almost dread getting up in the morning and going to work.
Yeah.
And those days usually end up being the most fulfilling for me, actually, because it's a challenge, but it's also like I can actually do something about this distress. And it's just a matter of connecting with those people and talking through and getting done what needs to get done. And then, after a day like that, I mean, like I said, sometimes that could be your most awesome day because that's when you're really needed. That's when you can really do some really good work.
Mm-hmm.
Um, and then and then you do have to look after yourself for sure. Like, I think I have been trying intentionally to look after myself for quite some time, because I remember like when my sister had cancer and things were maybe not super going well.
Mm-hmm.
It was kind of like things were getting a lot more difficult with her. And then my dad got cancer at the same time. And so I got shingles because I wasn't looking after myself. I just was pushing the rock, just going to work, coming home, looking after what needed to be done. Days off were spent, at doctor's appointments and whatever, and just the intense worry for my family. So things that I've been doing and things actually that I've started doing lately would be things like for myself, definitely reconnecting with nature, getting up and moving, those kinds of things definitely help.
Mm.
Um, Eating healthy, like I started cooking with fresh herbs because I started like bringing. I'm a huge gardener, but now I'm like a houseplant addict this year. Um, and so, yeah, just cooking with fresh herbs really makes the meal like you enjoy it more, right? I think that the big lesson here is presence, honestly.
Mm.
We have an opportunity that we have never really had before where we get to spend more time at home, more time with our families if we have. My family, I think I showed you the picture of Puppy at when we were at retreat.
Yeah.
My husband had said, "Look who's sleeping on your side of the bed," and I was like, "Oh yeah, whatever." And I came home and he hadn't gotten the puppy yet, but we did actually end up getting that puppy.
Mm.
So we have a COVID puppy, which was great because my youngest son is in high school, and so he had been doing lots of training with her, and the family, just all of us, like the boys are all at home studying at home, so taking the dogs for walks on breaks, just getting outside and doing stuff with them. They're so hilarious and they're such a distraction. So pets are good, and um, also, like, there's all kinds of virtual classes now for fitness. And the provinces are even providing fitness classes. Like they're supporting the small businesses, the fitness trainers, personal trainers to do videos and stuff for families. So I thought that was super cool. I still can't figure out if it's, I don't know why that's okay to be just like sore every day. When you were doing all that spinning for
Roller
roller shade, roller blade, what was it
brave,
called?
roller
Yeah,
brave.
roller brave. Yeah. Yeah, all that spinning. You know what I'm talking about? Like, I go to work sometimes wondering if I sit on that floor or if I sit in that chair, like, I'm able to get up again. Is that really what I'm supposed to be doing? But it's a good kind of sore,
Yes, there are
as
good
they
and bad
tell me.
sore. There is something as good and bad sore. I know that
Yeah,
for sure.
yeah.
Yeah, but
But
I
I sometimes will tell people too, even make a list. Make a list of all those things that you wish you had time to get done and start working on those things like organizing your photos, whatever, learning a new hobby, crocheting, making jam, whatever it is. Like
Mhm.
you have the time to do that now, right? So it's actually a time for us to slow down. Kind of like what do they talk about? Winter solstice, that time where you're supposed to just retreat and sleep a lot and read a lot and drink a lot of tea.
Yeah, that kind of equivalent. And I would say I love that you use the word presence, because I would say the reality, as we know, is that for some people, if they come back home from a work, a day at work, at a hospital, or wherever they work, they won't necessarily have the family element. And for some people, they haven't been spending a whole lot of time at home. But I think figuring out ways to be present, and also I would add, which is the buzzword, thanks to Brene Brown, but like also vulnerability in this whole thing, because I feel like there is not a whole lot of space anyway for those who take care of the healthcare professional, those who are have that job, sometimes to find space to maybe speak and share with colleagues or with people you trust what has been hard and what has been good in your day, is really important, because otherwise everybody can think that everybody else is, either everybody's like frazzled and stressed out all the time and that's the energy all the time, or you take a moment where you can stop and pause and talk to some of your colleagues to say, that was a hard one today. I had this or this happen, or today was beautiful and I had this conversation. But if we never ever take the time to stop for a moment and be present to have conversations like these, it accumulates. I do think that the stress can accumulate without ever really becoming mindful of where we are, what's happening now, acknowledging that sometimes, yeah, it's going to be hard. That's that's part of it, that we can't avoid it, we can't fake it. But ultimately, though, to allow those who care for others to sometimes need also themselves to be cared for. I think that's the balance.
Well, and I think that well, my sister is a teacher, she's a principal, so she has a huge amount of responsibility as well, right? A lot of my friends are nurses, so there's a lot more of, well, how was your day or how was your week? A lot more of that going on. And just like what you were saying, the questions even that we're asking our patients are different, right? Like I never ever had to say, so how are you maintaining a connection with your family? Because they would be there, they would be calling
Yeah.
me, they would be involved in the care. So yeah, I see that. Definitely looking after yourself is super important. And I think that, like, I'm in nursing, so we have a lot of organizations that have town halls, they have like weekly meetings where you can get together and just sort of talk about some stuff that I've seen is really pretty tragic, right? Some things have not gone the way that I would have liked to have seen it go. So there's lots of stories out there, but then there's also, all the wonderful stories and the things that wouldn't have happened without our situation the way it is right now. So, I mean, there's always that balance. And to be able just to express all those feelings and get them out is super important. Yeah. I was talking to a colleague the other day and I was saying, yeah, I got out my box. And she's like, what are you talking about, your box? And I said, well, I have a box of like little thank yous or little cards or little letters that people have sent me, families or patients or whatever. And I just put it all in this pretty box. And then sometimes on those really tough days, I will just get out my box and I'll just read through all that stuff and I will be like, okay,
Mm,
that's why I'm doing what I'm doing, and that's why I'm still gonna do it tomorrow, right?
yeah.
Yeah.
It's like a box of love, a box
Yeah.
of gratitude and love. That's a beautiful, beautiful way I feel like to end our chat together. Um,
Oh, it's that time already.
it's that time already, but
Yeah.
I do hope that this short conversation, again, like our goal, we'd never have the pretension to think that in 30 something minutes on We Get It will solve the problems of the world, but hopefully have conversations that get some people feel maybe like, oh, okay, maybe I'm seeing a little bit, and someone knows it can be demanding, and maybe get other people to think about it. That's kind of the idea. So hopefully you've enjoyed the conversation today, and that if you are a caretaker, healthcare provider of any sort, we know that this year has been extra demanding, but maybe out of this last chat that we just had, Christine and I, to just remember to take care of yourself in the process as much as you can. And like I do every Monday, I always remember everyone to just breathe. Just breathe, especially if you are in the craziness of what a workday can feel like in hospitals. I've worked there long enough to know sometimes it's a bit of a whirlwind. So just breathe and try and be present and come back to where you are, the the good you do, the purpose of your work, few deep breaths, and then keep going forward, and know that we are really grateful for all the work you do. I'm so grateful for you, my friend. Thank you for coming and having a chat with me today. And I hope you continue to take care of yourself and your family, and that you continue to be this wonderful nurse who does so much good to so many people. And for the rest of you, thank you for joining. And I hope you can join us again next Monday, 7 p.m. Eastern, live on Facebook. Have a great week. Bye.
Bye.